This is All India Radio. In the program Spotlight Now, we bring you a discussion on expanding health infrastructure in India. The participants are Dr. Raman R. Gangakhedkar, former head scientist, Indian Council of Medical Research, and Aditi Tandon, journalist.
The National Health Policy envisages total health for all and also expects that India will raise its health expenditure to 2.5% of the GDP by 2025. Dr. Gangakhedkar, we've seen that during COVID-19 pandemic, the government has gone well beyond its call of duty to ensure that everybody got vaccination, that there were indigenous vaccines, that the public health infrastructure was quickly ramped up, and as many lives could be saved were actually saved. You were at the center of the COVID pandemic response. How do you look at India's overall performance response during this very difficult period in the world history?
One thing which I would say is it was exemplary response for multiple reasons. One thing which we must remember, this was one disease which required multisectoral response. And to my mind, we have never given such coordinated response to any disease so far, especially in the shortest possible span of time. You talk of 2.5% as the budget, which we have exceeded today when it came to COVID. We must also remember that this is one in 100 years phenomenon. And the emergency demanded rapid action on different fronts. And that was the main reason why we had to perhaps spend little more than that. We had to ensure that we have response related to vaccine development and provision of vaccines. And provision of vaccines was also not so easy to be done because this was adult vaccination program. Whereas, in India, we have an excellent program that runs for childhood immunization. But we did not have a program for adult vaccination, which we managed to do extremely well. In terms of mortality, the statistics tends to tell you that our mortality rates were far lesser compared to rest of the country. If people may question that particular data saying that are these due to some kind of gaps in collecting the data on deaths that occurs in India, that doesn't remain relevant as of now. If you ask me, if you look at other countries, they continue to struggle even today with the COVID pandemic that they are facing in different parts of the world, including the most developed ones. So we have done very well in terms of health. That was possible at given point in time, the time that we had at our disposal. And we have also done very well on different fronts. And that's the reason why I think that our performance has perhaps been the best in the world.
Dr. Gangakhedkar, I would like to draw your attention also to the fact that the budget allocation for the Health Ministry has increased significantly from about 47,000 crore in 2017 budget estimate to about 83,000 crore in the 2022 budget, which is an increase of about 75%. Also, 4 mission mode projects have been implemented by the government. These are Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, which was recently announced, with an outlay of about 64,180 crores. Now, the objective of this particular mission is to improve the public health infrastructure in the wake of COVID and also ensure that at the district level there are, response mechanisms, laboratories, etc. How do you see this mission?
That's absolutely a required mission. If I recall, this was something which happened during time while I was working in ICMR. One of the things was establishment of infectious disease blocks at district level. Now, this was something which was essential because if you wanted actually to ensure that healthcare, which was so far known as more of preventive healthcare, now with the COVID pandemic, we understood the importance of care being given to patients who require intensive care. We needed those ID blocks. And that ID blocks thing was also included as the first feature. Then second thing which was also a part of the learning which we had started at that time during COVID and especially at the backdrop of Nipah and Zika, that we need to have One Health surveillance in place. Now, if you want to have One Health surveillance in place, you should also have a National Institute for One Health, which will perhaps lead that entire effort across. We also understood another importance of virus research diagnostic labs which helped us expand the entire network in a very short period of time during COVID for COVID testing, which otherwise was non-existent before. Now, if this was done, if VRDLs were also responsible for picking up new infections like Nipah that occurred in Kerala, all this was done through Virus Research Diagnostic Lab. So expansion of that network, creating regional level virologic research institutions was one of the other additional features that we required at that juncture. And this part has been taken up by the government, having understood how we could fight well because we had some infrastructure to fight against zoonotic diseases that tend to attack us. Now we have to expand that network because with the climate change, you are more likely to see new and newer emerging and re-emerging infections that may come. And we need to have that capacity to fight against that infection. So to me, 2.5% of budget or increase in budget and the intentions that we have shown so far are indicative of the fact that government has put health at the center stage.
Dr. Ganga Khetkar, the other three pillars, apart from Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, which you explained in detail right now, are Ayushman Bharat Health and Wellness Centers, Pradhan Mantri Jan Arogya Yojana, and Ayushman Bharat Digital Mission. So on these different fronts, not only creating a public health infrastructure and being ready for any future pandemics, the government is also trying to put in place a digital health mission. Plus, you will be happy to note today that transgender persons will also now get benefits of 5 lakh free hospitalization under the Pradhan Mantri Jan Arogya Yojana. The government has signed an MOU with the National Health Authority.
This is a very important development. To my mind, one thing which we have understood in COVID is how digital health programs, whether it was capturing the people who were getting vaccinated, people who had adverse events because of vaccine, people getting certificates right at the time when they got vaccines, it was all possible through digital health mission per se. Now, one thing which we have to understand is you will find that over a period of time, the digital health mission will play a key role in a country where the penetration of internet, the penetration of mobile phones has increased dramatically, and it will perhaps keep on increasing over a period of time. It will not only ensure that you will reduce wastages, you will perhaps have more correct information, more timely information on different health outputs that could come through the programming that is being done. But at the same time, it will also ensure that timely action, as suggested by the data that tends to come to us, can be undertaken through big data analytics at this point in time. With respect to what you talked about the transgender community per se, I think this was a long-standing demand. And today the government has taken a very progressive step that their health will be taken care of through our own public health programming, which was not something which was easily feasible, mainly because, you just imagine a transgender walking into any hospital, they would be put off by one fact that they won't have a cell as to who will provide this care. Should they be going female ward? Should they be going to a male ward? Would be a different question. And then would people be comfortable if they are put up there? And that fear used to drive them away from public health, our own public health hospitals per se. This assurance, I'm sure that the inequity in healthcare that existed in transgender fraternity will perhaps be reduced, and we look forward to a new era where equity will also be at a paramount or an important level, and we will continue to do well for our own population.
Prime Minister is in Punjab and Haryana today, Dr. Ganga Khetkar, and he has inaugurated a very important health facility, the state-of-the-art Amrita Hospital at Faridabad, where he also said that India did not face any kind of vaccine hesitancy as other countries saw, during the COVID time, because of the message from spiritual leaders and also because of the government's outreach to the people. Right now, booster dose and precaution dose is being provided free of cost at all government health facilities. How do you see the slow and low uptake of precaution doses in the country, and what is your message to the people?
One simple thing which I would say, I fully agree the statement that our Honorable Prime Minister, that we perhaps faced the least amount of vaccine hesitancy. You look across everywhere in the world. even today when they are facing the pandemic, one of the main reasons is they don't have their population which is saturated with vaccine coverage per se, and therefore their deaths are also more commonly are higher in the developed world as of now. The issue is this was mainly possible because of community mobilization that was done firstly through Prime Minister's messages itself. Now, if you recall, Prime Minister used to come out with a different slogan every time when he was trying to support the program for adult vaccination, which was never done in India. It was also ably supported not only by the community, but also community leaders, which included spiritual people, for the sole reason that there were different kinds of discussions that people used to make on WhatsApp, whether this is something which would be allowed in their own religion. Even that was possible. So community mobilization was a critical issue which was handled by people at this juncture effectively. There is one thing which we have to remember. People responded to every call that the Prime Minister made, every call that the public health experts made, every call that their own community leaders made. But when it comes to 2 years of period which they have faced as a difficult period of their life, the issues of livelihood have become important for all of them. And one of the things that happens is people are placing priority towards these livelihood issues as of now compared to the issues related to taking boosters. But I think what is important, which people have to realize, which may require few hours of our time, but if it is going to reduce your risk by 80% to 90% of hospitalization and death that could occur because of COVID, and these vaccines are freely available in the government setup, why should we not take it? I think it is time that every vulnerable person, those at least who are more than 60 years of age, those who have chronic morbidity, should prioritize their life, reduce the risk of hospitalization and death by taking one jab which is required for booster. And it would not be, to my mind, fair to expect that every time they should take it through messaging that tends to come from higher ups. I think it is time we should become responsible for our own health. Having done so much today in COVID in last 2 years, it is important that we should give importance to our own health, because it is your action which will safeguard your family's morbidity that they are likely to face with the transmissions that could occur or hospitalizations that could occur.
Dr. Ganga Khetkar, you've spent all your life in improving the country's public health infrastructure response. What, according to you, is required to further strengthen the integrated disease surveillance program, considering we already have units across more than 700 districts now? Do we need a public health cadre, a devoted cadre?
We will need public health cadre, there is no doubt on that particular issue. But I think what is required is more coordinated effort. You were talking in terms of IDSP, which is surveillance that takes place among human beings. We also need a coordinated action with veterinary department, agriculture department. The One Health surveillance is actually the need of the hour today. If we have a coordinated response, that would be great. Second thing where I feel the country must invest is into community-based surveillance. And when I mean community-based surveillance, I mean, why can't we have lay people who would report a suspicious death, a death that they could not understand why such a person has died, not because of the criminal causes per se, but if we are unable to understand a death that has occurred in the house, why can't these people be utilized as informers and informed IDSP so that IDSP can take action immediately and try to find out the cause of this particular death that has occurred and try to pick up these new infections that tend to occur little earlier than what we have been doing so far. We are on the right path. We may have to take additional steps, and I'm sure we will over a period of time and cover ourselves with excellent surveillance data so that we don't get surprised like we did in COVID in future.
Absolutely. Dr. Ganga Khetkar, thank you so much for your time.
You were listening to a discussion on expanding health infrastructure in India. The participants were Dr. Raman R. Ganga Khetkar, former head scientist, Indian Council of Medical Research, and Aditi Tandon, journalist. This program was produced and presented by the News Services Division of All India Radio.